The number of MERS cases is still on the rise. 14 new patients were confirmed today, bringing the tally to 122.
One additional death has been reported and more than 3,800 people are in quarantine. For more, we connect to our Connie Kim, standing by the news center. Connie, can you take us through these new cases?
A couple of hours ago, the health ministry confirmed the 10th MERS death in Korea. It's a man in his 60s who was hospitalized in the same facility as a MERS patient. Health officials say the man who died was receiving treatment for lung cancer. 8 of the new infections came from Samsung Medical Center in southern Seoul, where 55 MERS patients picked up the virus. Most of them contracted the virus through the hospital's emergency room, but one case stands out. A woman in her 70s was in the hospital for knee surgery. She never visited the ER, so health officials are questioning how she contracted the virus. There is another transmission that's also under scrutiny. A police officer who had tested negative but is now a confirmed case. Last month, the officer met twice with a friend who had visited Saudi Arabia. After developing MERS symptoms, the officer visited a hospital in Pyeongtaek. A confirmed MERS patient had already visited that hospital as well. The officer tested positive for MERS and was transferred to Seoul Medical Center, but tested negative there and was discharged and quarantined at home. And after developing symptoms of pneumonia, the officer went to Asan Chungmu Hospital and was moved to Cheonan Dangguk University Hospital on Tuesday after his condition deteriorated. Officials there ran 2 tests to confirm that the officer is indeed positive for MERS. To recap, the patient visited a total of 4 hospitals. Health officials say it's mostly likely he contracted the virus from the first hospital, but they're looking into the possibility of an airborne transmission. Authorities are also investigating the conflicting MERS test results, which also appeared in the case of the pregnant woman at Samsung Medical Center. And in Seoul, a second hospital has closed its doors temporarily after a confirmed MERS patient visited the facility. The first hospital to close was Pyeongtaek St. Mary's Hospital, where the first MERS patient infected 36 other patients.
And Connie, what new steps has the government taken to clamp down on the spread of the virus?
Well, today officials announced plans to keep a number of hospitals free of MERS and able to serve the general public. Now, they plan to announce the details on Friday, but the strategy was created to allow the public to go to the hospital without the fear of contracting the virus, and also to ensure that suspected MERS patients will no longer be denied care. And as of now, there are 16 hospitals designated to treat MERS patients only.
Well, the general public, namely parents, have a lot of concerns about the virus. Hundreds of schools have closed down temporarily as a result. Connie, are we expecting any of the schools to reopen anytime soon?
Well, Gyeonggi Provincial Office of Education announced the province will reopen all schools in 7 areas in the region. Gyeonggi, the province, is where the first MERS case was reported last month. The Education Office's spokesperson explained the decision was made to resolve disruptions in the curriculum. The spokesperson added that the decision was not made by the WHO team that's in Seoul to assess the MERS outbreak. And just yesterday, the WHO officials had said schools should reopen as all MERS cases originated in hospitals, not schools. Today, more than 2,400 preschools and elementary schools were closed temporarily. Back to you.